Let's talk about some of, let's say, the few most common pelvic floor issues. And what are some of the sensations that, or experiences or symptoms women might be looking for to let them know, hey, time for me to maybe think about doing something about
So
this?
I think when we think about, what this muscle does, it helps hold in urine, hold in stool. It has to relax to empty well. It, has the opening to vaginal intercourse, menstruation or insertion of menstrual products. It supports our spine. It supports our organs. So I tell people when they ask, like, how do I know if I have an issue? And I say, if you're experiencing discomfort, pain, leakage, anything in this part of your body, your muscles are likely involved. So with respect to bladder health, we commonly talk about urinary leakage, which is hands down one of the more common experiences we see in our clinic, but it's also frequent urinary tract infections or overactive bladder syndrome, or actually difficulty emptying your bladder. Some women feel like they have to strain or push to get their stream started, or they may stand up and walk away and then dribble a little bit afterwards. Anything with their bowels. So it could be hemorrhoids, fissures, which are little tears in the anal sphincter, but also constipation, which is one of the number one GI complaints in the country, and then fecal incontinence or difficulty holding in stool. And then pain is a big one. I think we often talk about pelvic floor muscles being weak, but I would say as many people have pelvic floor tension.
Mm-hmm.
And this is when the muscle is tense or tight and it doesn't relax well. And this can lead to pain such as tailbone pain, low back pain, pubic bone pain, but often sexual pain. So painful intercourse, painful tampon insertion, speculum insertion, difficulty inserting anything into the vagina, whether it's for pleasure or it's for function. And I think we don't realize that muscle tension can be causing these. Just like, I get tightness in my shoulders and neck and I start getting headaches. It's the same thing for your
Mm-hmm.
pelvic floor. And we see it pop up in that way. So when I tell them like, oh, sex is so painful. And I'm like, oh, this is literally like a muscle spasm. And when we address that, they can get so much more relief. And I think just helping women through that process is really awesome. And then the way what you mentioned is pelvic organ prolapse, which
Mm-hmm.
is when that hammock of muscles isn't supporting your pelvic organs as well. So your uterus, your bladder, your rectum, and those muscles start to push into the vaginal canal, and you can often feel a bulge at the opening of the vagina. Maybe when you're washing the area, you feel something kind of protruding. It feels like heaviness or pressure that gets worse at the end of the day, but it can also lead to straining with urination and bowel movements.
Mm-hmm. I'm really glad you mentioned constipation. So many people are just really excited about gut health, which I think is incredibly wonderful. And there are so many people with their cures for constipation, which are great too, like take magnesium, use your botanicals, all the things I do in my medical practice. But one of the things that my decades of work has really shown me over and over is that you cannot cure pelvic floor problems that cause constipation with senna or magnesium. It may help a
Right.
little, but you really have to address the pelvic floor. Let's talk about how we can know the difference sometimes, whether pain or pressure or constipation is due to pelvic floor issues or whether it's something else.
Well, it's tricky. It's a little bit of the chicken or the egg. It's like, were you constipated and then that caused muscle tension and now
Mhm.
it's hard to empty? Or did you have muscle tension and that, caused you not being able to empty stools well and now they're hard and backed up? And so it's a little bit of a cycle. I think what's really important is putting all of those pieces of the puzzle together. It's not just taking magnesium. It's not just drinking a lot of water, getting exercise, but it's also making sure that you are relaxing your pelvic floor muscles well, that you know how to poop properly.